So, good noon, everyone. So, we'll be reporting about DOH Infant and Young Child Feeding National Plan of Action Activities. So, DOH Infant and Young Child Feeding National Plan of Action Activities. Breastfeeding is the first preventive health measure that can be given to the child at birth. So, it has a multitude of distinct advantages. However, breastfeeding remains in the worldwide agenda as global exclusive breastfeeding rates remain low at 38%. So this suboptimal breastfeeding practice contributes to 800,000 infant deaths worldwide, which affects the overall reduction of newborn infant and under 5 mortality rates. In 2004, infant and young child feeding practices were assessed using the WHO assessment protocol. These activities were initiated to breastfeeding within an hour after birth. So 3 out of 10 infants less than 6 months were exclusively breastfed, and the median duration of breastfeeding was only 13 months. The complementary feeding rate was 99% of 6 to 9 months children received complementary foods while continuing breastfeeding. Action typically includes a range of infants and young children. These activities may include policies that support breastfeeding, complementary feeding, and overall infant and young child nutrition. Number two is advocacy, advocating for the protection, promotion, and support of breastfeeding and appropriate complementary feeding practices through various channels, including media campaigns and community outreach programs. Number three is capacity building. Focus on best practices for infant and young child feeding, including breastfeeding support and counseling. Number four is community mobilization, engaging communities through education, support groups, and peer counseling to create a supportive environment for breastfeeding and appropriate complementary feeding. So I'll pass on to the next reporter.
So for the five, monitoring and evaluation, establishing uh, establishing systems to monitor and evaluate the implementation of the plan, including tracking breastfeeding rates, complementary feeding practices, and nutritional outcomes among infants and young children. So six, research. So conducting research to identify barriers to optimal feeding practices and to inform the development of evidence-based interventions and policies. Next, seven, coordination. So facilitating coordination among relevant stakeholders, including the government agencies, the non-government governmental organizations, health, healthcare providers, and community leaders to ensure a comprehensive approach to infants and young child feeding. So program description. So to address these problems on infant and young child feeding practices, so the first national IYCF plan of action was formulated. So it aimed to improve the national status and health of the child, especially under 3 and consequently reduce infant and under 5 mortality. Specifically, its objectives were to improve, protect, and promote infant and young child feeding practices, increase political commitment at all levels, and to provide a support and environmental and ensure its sustainability. So the main efforts are directed towards creating a supportive environment for appropriate IYCF practices.
So goal to reduce child mortality and morbidity through optimal feeding of infants and young children. So program objective to ensure and accelerate the promotion, protection, and support of good IYCF practice, which includes good breastfeeding practices. So outcomes. By 2016, 90% of newborns are initiated to breastfeeding within 1 hour after birth. 70% of infants are exclusively breastfed for the first 6 months of life, and 95% of infants are breastfed within 6 months of age.
So targets. So by 2016, 50% of hospitals providing maternity and Child Health Services are certified MBHFIH. So 60% of municipalities, cities have at least one functional IYCF support group. Next, we have the 50% of workplace have lactations units and or implementing nursing and lactation breaks. So the target beneficiaries of the program are infant 0 to 11 months and young child 12 to 36 months years of old or 1 to 3 years old. So the key intervention settings and services are strategies, pillars, and action points. So next, so next boss. So for strategy one, we have the partnerships with NGOs and GOs in the coordination and implementation of the IYCF program. So first, we have to formulate partnerships with GOs and NGOs working on the IYCF program. Coordination and implemented by, so we have the strengthening the TWG to allow it to effectively coordinate the GOs and NGOs working for the IYCF program. Next, we have the returning of MBFHI to be under the umbrella of the IYCF program so as to be in a better position to consolidate efforts towards the MBFHI compliance. So, next, we have the augmenting human resources complement of NCDPC, FHO, and IYCF program funds shall be allotted for job orders for this purpose. So lastly, we have the program contracting out of activities to organizations outside the DOH. So it shall be implemented simultaneously in a different intervention settings and a faster pace. Next.
So strategy 2, integration of key IYCF action points in the MNCHN Plan of Action Strategy. So institutionalize the IYCF monitoring and tracking system for national, regional, and LGU levels. Institutionalize the collection of PIR data and generate annual performance report. Maximize the use of unified monitoring tool. A simple data management program shall be developed to facilitate the consolidation of data extracted from monitoring. Collaborate with the National Epidemiology Center and Information Management Service regarding IYCA data. The current records and reporting being collected by the DOH reveal that health information system will remain a main source of data from healthcare facilities. However, collaboration with NECT and IMS to improve data quality and include data on complementary feeding is essential. So participation of the IYCF focal person in MNCHN planning and monitoring activities. The IYCF focal person shall help ensure that in the multitude of activities, critical IYCF action points and indicators are not overlooked.
So for strategy 3, so we have the harnessing the executive arm of government to implement and enforce the IYCF related legislations and regulations. So first we have the consultations mechanism with the IAC and the DOJ for the enforcement of the milk code and with other relevant GOs and for the other IYCF related legislations and regulations. So the goal of the consultation mechanism is to develop activities that will focus on facilitating the process of monitoring of compliance and enforcement of IYCF related laws and regulations at regional and local levels in the 5 IYCF intervention setting. Next, we have the support civil society. So, in the implementation and enforcement of IYCF related laws and regulations, so we have the institutionalize enforcement of the MBFHI compliance in the regulatory functions of the DOH. Next, we have the inclusion of the MBFHI MBFHI requirements in the Unified Licensing and Accreditation benchmarks of the BHFS and the licensing offices shall be pursued more vigorously in the collaboration with BHFS and licensing offices of the regional offices. So these offices are in the better position to enforce compliance in relation to the regulatory functions and in their power to promulgate penalties for violations. Next, we have the review and improve the processing of reports and violations on the milk code. Next, we have the invite the professional regulatory boards as a resource agency of IAC. Apart from companies who are actively marketing breast milks substitutes, health professionals and who have access and influence on pregnant and postpartum women are also among the most common violators of law. Next, we have the augment humans resources, a resource of FDA as Secretariat of IAC. Lastly, we have to engage professional societies to come up with measurements for self-monitoring and regulations. Next.
So strategy 4 is intensify focus activities to create an environment supportive to IYCF practices. So modeling the MBF system in the key intervention settings in their selected regions. To set up models of MBFHI and MNCHN implementation in key strategic hospitals and referral networks. So regional hospitals and selected private hospitals shall be developed as models of MBFHI and NMCHN implementation to help create an impact and to serve as showcases for other health facilities.
Dili
Regional
mo
hospitals
magrahang.
shall be developed as
That's
models
all
of
for our report.
MBFHI and implementation
Ha?
shall be conducted in collaboration with local authorities.
Di na
Collaboration
mag-water?
between hospitals shall be encouraged so monitoring and evaluation can be done more frequently at the provincial and municipal levels. Establish protocols, standards on how to set up and maintain MBF workplaces and integrate them into the standards for a healthy workplace so the IYCF program shall focus on the enforcement of standards. Establish mandates workplace to establish lactation stations and/or grant breastfeeding breaks. Guidelines for the establishment and maintenance of MBF workplace shall be developed. The establishment of MBF workplaces shall be expanded to include government and private offices in line with expanded Breastfeeding Act. Enhance the primary, secondary, and tertiary education curricula of on IYCF. The initial collaboration for the enhancement of the primary, secondary, and tertiary education curricula shall take place at the Central Office of DepEd, Bureau of Elementary Education, Bureau of Elementary Education, regional and national incentive and awarding system for the most outstanding IYCF champions in the different sectors of society. So funds for the award shall be secured. Establish a recognition system for health facilities complying with EO51, RA128, and MBFHI national policy. Set up an annual recognition systems for facilities, establishments complying with relevant IYCF legislations and regulations. So lastly, allocate six resources for IYCF research activities that document best practices in the Philippines.
So lastly, we have the strategy 5. So engaging the private sector and international organizations to raise funds for scaling up and support for the IYCF program. So pillar 1, we have the capacity building. So capacity building shall take a different forms and intensity in accordance to the requirement of the intervention settings. So the healthcare facilities training and the lactation management and counseling shall continue. So a system for regular in-service or refresher training to address the fast turnover of the health staff in the hospitals and to provide necessary programs updates shall be put in places. So strategy training and self-enforcing programs may be devised to improve access to training when warranted. So periodic programs may be devised to improve access to training. I mean, periodic evaluation shall be incorporated into systems to ensure effectiveness and efficiency of the training. So, these activities aim to address the multiple determinants of young infant and child feeding practices, so including social and cultural, economic, and environmental factors to improve child health and nutrition outcomes. So that's all for our report. So